Well, good afternoon, everyone. I know people may click in after we get started, but I'm so glad that you can join us here for lunch. I know our days are busy. Uh, and again, this is our reviewing our final steps for our 2022 ACO performance year and the quality reporting that's needed to complete that. We do have a lot of information to cover, and this is being recorded to review again, or for our other colleagues that couldn't join us at this moment. Once again, you're joining and viewing this because your practice is not only part of our PA clinical network, but you're also part of our ACO in 2022. We thank you for your membership and the great care that you provide all your patients every day, especially during these difficult times. We're going to actually have you hold your questions toward the end, or if you want, I think chat is enabled, and you can type it into the chat function, and then we'll get them to the end. Some of them may be answered as we go along. If we don't have time, we'll get back to you individually, and we'll also try to compose a FAQ if there's a couple of recurrent problems. I know that we'll be able to stay over a little bit past the hour. Our data partner HealthEC is with us. I think they may have a little bit of time to continue on, but I know that your days are busy and may not. So we want to make sure we cover at least all the basic material and then get to the questions as we go through after that. In summary, being part of an ACO requires quality reporting, and that deadline is kind of right around the corner. Our ACO CMS assigned number is A5030. You don't have to know that. We are in the basic or the track A, upside only, meaning that we don't have any risk or we won't have to pay anything back in the end, but we get to share savings if there are any there. We do a retrospective reconciliation. That's something we don't need to get into today, but part of it is that, to get to the shared savings, there's a quality threshold gate that you need to meet. It's not a very high gate, but it still requires completion of quality metrics in order to get it. And again, there's no downside risk in the version that we're in at this time. The reporting interface that we need to submit needs to go to CMS next month. For the purposes of these practices, and this is kind of the little shocker or reality check, it's right on us. The next 2 weeks, we need to get through the last bit of patients that are left. A large amount of them have been closed already. Your quality team has been working, and actually the data engine behind this has been working, but we need to get work together, and we'll highlight each of your practices will be highlighted a couple of patients that we need a little bit more information in order to close the gaps to do that, and we need it before the 10th in order to successfully close out this year. In our network, we have 30 primary care practices, about between 7,000 and 8,000 lives, kind of right in the middle, and collectively spend over $70 million in the Medicare space. And again, this is an alternative to MIPS. If you're not in an ACO, you would submit MIPS, but in ACO, you're allowed to do this alternative quality reporting that's available to practices in the ACO. I understand that some of you may have done your MIPS anyway. There's no harm in doing that. These are the practices again in the network, but this is required of our ACO. CMS assigns 10 metrics to this, and the patients are chosen randomly by that. And there's about 250 patients per each of the 10 measures, and there's a total sample pool of about 700 patients per measure. Now you can skip patients until you get to the total of 250. If you'd have a whole bunch of skips, that can risk you can risk an audit in that. So you want to minimize the skips when you have the information. Answer it. It may close. Hopefully it closes the gap, but it may not. But skipping has a downside to it as well. Here are the 10 measures, which some of you may be familiar with already, but these are the ones that CMS is requiring us to report on. Again, they'll assign about 250 patients per measure need to complete that. They'll give you a total of 700 patients to choose from, but they rank it in order. So you need to go through the first 250 before you get to 251 and 252, and you skip, if you skipped in doing that. I highlighted two of them there: depression in general and depression remission, as well as the statins and cardiovascular disease, are some of the more complex measures because there's a lot of if-thens in it. Basically, a A1C is either a compliant measure or it's not. A blood pressure is either a compliant measure or it's not. But these have a little bit more thought involved in it. This is our status. I think this is pretty recent, and I'm going to rely on our HealthEC teams just to say this is kind of where we're at. So we've completed 744. There's 435 left to go. As you can see, the depression at 12 months, the remission one is one that has a lot of measures left, again, because that is a complex measure in terms of doing that. And we understand, we may need to talk a little bit to help complete that one. There are guidance documents that CMS puts out for each of the measures. They contain the specific, and they also give examples of codes in that. We are going to make sure that this is posted as a resource on our PACN website so that everybody can have it. We didn't want to slam you with all of this information going forward. However, if you do want it emailed to you as a zip attachment, we can do that as well. And again, that's just kind of background information. Our HealthEC team is going to explain the process of data entry in there. And again, the G-Pro, the process takes into account the measure requirements in doing it. But of course, there's always technical or finite questions that will come up. And again, we're here to do that. This is our network website, if you don't have it already. Again, if you need help with the website and getting on, or you forgot your login or your password, you could do this. This is a member only section, but I guess we could put this resource maybe not locked in to member only. That just you come onto the website that you can get it, and Keith is nodding appropriately for that. Once again, the deadline is right around there, and again, our quality team in the next week or 10 days is going to be reaching out to you with these patients to do that. It's about 10 patients per practice. Some of the bigger practices have a little bit more. Some of the smaller practices have a little bit less, but what's remaining is about 10 patients. So it is a doable amount, but again, that deadline kind of sneaks up on us quickly. Shortly, I'm going to hand this over to HealthEC. Again, that's our data company that's working behind us. They're going to do some screen sharing too and explain at least the G-Pro part. I believe that most, if not all of you, got the opportunity with a login name and maybe temporary password to get onto G-Pro. And again, as you're able to do that, that'll help us. With that, do you want me to stop screen sharing, Patrick and Kevin?
Yeah, that would be great. And then I can go ahead and share my screen.
Okay, let me figure out how to do that. Stop sharing.
Well, while you guys are going through that, Dr. Pagan, this is Kevin. I just wanted to thank everybody for attending, and Patrick will cover the bulk of this, but in the tail end of Dr. Pagan's comments, he covered one of the critical items, and that is that the 700 patients is ACO wide. It's not for any given practice. And for all but about 2 or 3 practices, the number of outstanding patients at this point is in the, I'd say, about the roughly 10 range. So hopefully we've been able to get this narrowed down so it's not too overwhelming for you. So because I know everybody is super busy. and don't have a lot of time to go through these exercises. So Patrick, let me turn it over to you.
Sure, great. So I just wanted to check that everybody could see my screen, which is just a quick slides that are up right now.
Yep, we see that.
Great. All right. So to quickly introduce myself, my name is Patrick Cordes, and I'm a senior population health and quality measure analyst here at HealthEC. I've been in the quality reporting world going back to 2014 when I first started my career. Back then, I worked doing the physician quality reporting system as well as meaningful use, which then graduated into the MIPS program. So we know that the MSSP ACL reporting revolves around the MIPS reporting world, which I'll touch on highly today. So just as a quick agenda for the slides before I do head into the walkthrough of our GPRO system. So just so everybody knows, I'll give a quick overview on the APM performance pathway. That is where the CMS web interface known as GPRO and also your MSSP quality reporting sits in. The CMS web interface itself, along with the benchmarks, so that's tied to those quality performance standards that Dr. PACN was mentioning before, accessing our GPRO system, and then the walkthrough of our GPRO system as well. So the APP, which stands for the APM performance pathway, is a MIPS reporting path and scoring pathway for MIPS eligible clinicians who participate in a MIPS APM. So an APM is an alternative payment model like your Medicare Shared Savings Program that you all are participants in. The APP was designed from CMS and under the MACRA legislation to reduce reporting burden and create new scoring opportunities for participants in MIPS APMs and also to encourage participation in MIPS APMs. There is 3 performance categories that there is performance measured across. We will be reviewing the quality reporting category today, but there is the quality, which is weighted at 50%, improvement activities at 20%, and promoting interoperability at 30%. So we're going to be focusing on what's called the CMS web interface today. The CMS web interface is also known as the GPRO, which stands for the group reporting option. So by being a shared savings ACL, you're actually automatically registered to participate in the CMS web interface. So the CMS web interface, what it requires the ACO to do is submit data on a sample of Medicare patients for each measure within the application. So across the entire ACO, CMS picked out a little over 2,500 patients, which are included in your Medicare sample. And then on the 10 measures, which you'll see on the next, one of the next screens, is those patients are ranked across those measures depending on their diagnoses, maybe encounters that they had during the year. And that's the way that we have to go ahead and collect the data. So as far as where we will be working with is the CMS web interface measure. So there's a total of 10 measures also included under this quality category, which are measures you do not need to worry about, is the CAPS for MIPS survey, and then administrative claims measures. So as you can see on this screen, this shows your quality measure set that's included under your quality reporting. So there's about the 10 measures which are included within the CMS web interface. So we have the hemoglobin A1C poor control, influenza immunization, breast cancer screening, colorectal cancer screening, screening for depression and follow-up plan, tobacco use screening and cessation intervention, controlling high blood pressure, screening for future falls risk, the depression remission at 12 months, and also the statin therapy for prevention and treatment of cardiovascular disease. So as if you have participated in MIPS before, which I'm pretty sure by being in this Medicare ACL you have, these are probably measures which you may have already reported from in the past and may be quite familiar with as well. So just to touch on the shared savings performance standards. So as the ACO as a whole, the way that the reporting works is your performance across all the practices is brought up to the top level of the ACO, and you're all reporting together as one. So you're aiming to hit at least the 30th percentile, which is actually the lowest percentile to hit to meet the performance standard. So as you can see on this screen, where the ACO is driving towards is meeting that 30th percentile, but also if you do higher than that, that's better as well and will help improve your quality score. So as you can see on majority of these measures in that 30th percentile column, most of the performances are within 30%, and then as you go up 40, 50, 60. Now, if you are familiar with benchmarks from the MIPS reporting program, you may know that the benchmarks don't necessarily look like this. So under the CMS web interface program, CMS did apply what's called a flat benchmarking methodology, where you can see it goes from 30, 40, 50, and so on. However, in the case of the diabetes A1C poor control, that's an inverse measure. So you can see the performance goes opposite. Obviously, we want less patients that have a high A1C. So that's why that measure goes in the opposite direction for the benchmark, also known as an inverse measure. So Dr. Pagan did show this information before as well. So overall, where we are sitting at right now with data that we did have from you all is we're sitting around a 75.4% completion and based on the ranked patients. So when I say ranked patients, what that means is CMS requires out of that Medicare sample for you to collect, for the ACO to collect your first 248 ranked patients. So what that means is that you can have patient Joe Smith, who's ranked number 1 for a measure, for let's say the fall screening measure, and that's the first patient that's required to be collected on. Now, if a patient does have a reason to be skipped, where that could be that the patient passed away during the year, or if there's a measure specific reason where they are a medical reason for them to be skipped from a measure, then what that does is it makes you now have to collect one more patient. So the more patients that are skipped, the further that you do go up your rank. Now that's not necessarily a problem, but you do want to be aware of the patients that you're skipping and making sure that it's for a valid clinical reason to the measure or to the patient. Likewise, on this next slide, just to show the overall completion across the entire population. So each one of these measures does have a more than the 248 patients that are required to be collected on for the measure. So what you can actually see in this total column is each one of these measures have 616 patients, with the exception of the statin therapy measure, which is at 750 patients that are ranked for the measure. So that means out of the 2,500 patients roughly that are assigned to the Medicare sample for the PACN ACO, 616 patients for each one of these measures was ranked 1 all the way up to 616. And that's the order in which you would collect the data on those patients. Now I'll go into accessing the GPro system. So just as a note, you should receive 2 emails from L2support@healthec.com. One with the subject of Welcome to HealthEC Population Health Management Solutions. And this includes your username and a link to the GPro website, which is there. And then another email, which would be HealthEC Population Health Activation Password. So obviously for your own protection and security, once you first log into the system, you'll be prompted to answer your security questions and enter in a new password. We do highly recommend that you bookmark this website for easy access. And we also recommend that you use really modern browsers to access the website itself. So I'm sure all of you already do this anyway, but just for reference, you would want to try to use Google Chrome, Mozilla Firefox, or Microsoft Edge. So just to show you what that email actually looks like. So you can see on the screen here, this is an email to myself. So you can see that you'll have this email again with the subject of HealthEC Population Health Management Solutions Welcome. And in here, you'll find your username, which I have highlighted in that red box there. And then a little bit down below, you'll see the URL to access the GPro site as well. Following this email as well, you'll receive a second email, which is a separate email with your activation password. So what you'll see is an email that looks like this, and included in here will be your activation password. And obviously I have mine blurred out here, but you'll have yours there. So it will be next to the activation password there. So you want to make sure that you're copying and pasting that over when you're first logging into the system, and then you'll be prompted to enter in your security questions and enter in a new password as well. The site, when you do land on it, is going to look like this screen. So again, I have that URL popped up there. Don't worry about copying it down now. We'll make sure that you do all have access to that URL, and it should also be in that welcome email with your username as well. So just as far as support too, so for any quality and data collection efforts, we do want you to reach out to your dedicated PACN quality director, who will also be reaching out to you. So they'll be leading the effort with your practice in order to do this data collection. If there are any issues with user accounts or your passwords or accessing the system, I do ask that you would email myself, which my email is on that screen. So that's patrickcordes@healthec.com. And then also Anita as well with her email. So I'll make sure that the PACN team has this and that is communicated across to all of you as well. All right, so now I'll go ahead and actually go into the system itself. These slides as well will be available to you all so you can reference these back. So as I said, when you first click on that link from your email, you'll be brought to a web page that looks like this, which is just our login web page. So when you first log in, you want to make sure that you have your username in there as well as your activation password. So you should see a screen like this where you'll be able to set up your security questions. So just like any other website that does require a secure login, you should be familiar with putting in different security questions. So just for the purpose of this, I am just going to answer everything HealthEC. Obviously, you should not have your security questions all be the same answer, but that's what we'll do for right now, just to show you how the system works. All right, and then you'll be seeing on this, and you'll see that your password has been successfully updated. So now once that happens, you'll be able to log into the system with your newly updated password. Okay, so when you first log in, what you are going to see and be brought to is this patient search page. So this will be your landing page within the G-Pro application. Now, when you're logging into your practice specifically, you will only see patients that were assigned to your practice under your Medicare sample. So what you'll see here is a list of your patients and a couple of points of information here. So you'll see their member ID and their insurance ID, which would actually be their Medicare beneficiary number, their last name, first name, gender, date of birth, the provider, which they were assigned under, their region, your practice name, the chart chaser, and then also their G-Pro status. So this G-Pro status right here is an important column to note because this is actually going to let you know the status of your patients. So when you first log in, you may see patients that have been skipped, patients that are completed, patients that are pending. So what that means is a couple different things. So a patient that is completed, it means that the data collection or the data that we did have from clinical data or claims data has already completed those measures for you. If a patient is skipped, that means that there was a medical reason or a patient reason for that patient to be skipped. So for example, if a patient did pass away during the measurement year, a patient could be skipped due to that reason. And then finally, pending, what that means is that there's still measures to be collected for that patient. Now, when going into one of those patients, you may see that they have a few measures completed already, or that they need to have all of their measures collected. So that's all dependent on the data that we had available to answer the measures itself. So up here on this patient search section, there are a couple of things that we would want to hit on. So if you are looking for a patient specifically, you are able to search for them specifically. So we have search fields such as the last name, first name, the patient's date of birth, the provider NPI. You can search by your practice, the member ID, the GPRO status. So if you did want to look for patients that are specifically just pending, you can look for them. If you wanted to look for a specific measure and look at those patients as well, you can search for there. And if you also wanted to search by rank as well, you can search that. So what I'll go ahead and do right now is I'm going to go and search for a patient that's still pending. So what that means is that this patient still has data that needs to be collected. So I'm going to hit on this first patient here. So to go into a patient, there's this little hand icon, and that allows you to select the patient. So when you click on the patient there, what you will be brought into is a screen that looks like this. Now, depending on the data that was available for that patient, it may look a few different ways. So when you first log in, there may be a confirmation of is the medical record found. So up here is where you would actually be looking at what's called a patient skip reason. So a patient skip reason can be due to a couple different reasons that we do see here. So one is that we do have the member ID for the patient, and then two is the patient confirmed? So what that means is if you have access to the patient's medical records and there was no reason why the patient should be excluded at the patient level, then we want to go ahead and click yes there. The reasons as to why a patient could be skipped at the patient level are the reasons that you see here. So if the patient was in hospice during the measure year, if they moved out of the country during the measurement year, if they passed away during the measurement year, and then also if they were not enrolled in a fee-for-service Medicare plan during the year. Now, one important note on that is if they were a dual eligible patient during the measurement year, those would still count. And if they were active at any time during the measurement year, that still counts as well. When I do speak to the measurement year, what we are speaking to is the calendar year of 2022. So that's from January 1st of 2022 to December 31st of 2022. If the patient did fall into one of these reasons, let's say if the patient was found to be in hospice during the measurement year, then we would go ahead and enter in, click on no in hospice, and then you would want to provide the date that that patient was in hospice care during the year. Likewise, for any other one of these statuses, you'd want to hit the one that is applicable and provide the date that's within the measurement year. So now if we go down here to the measure status, you're going to be seeing a couple different items here. So at first, what you'll be brought to is just the pending screen. So if your patient has any pending measures, that's the measure that you're going to see here. What we also see is that there's also the completed measures, skip measures, and then also all measures. So if you have a patient where, let's say there was this one measure that needed a little bit more data to be completed, then that one measure will be left on this pending icon over here. If they already had other measures completed, you'll see them under the completed icon here. So what you can see for this patient is they had their A1C measure completed, colorectal cancer measure completed, as well as the statin therapy measure. If they had any patient measures that were skipped at the measure level for any reason, which we will show, then they would show up under here. And then also if you click on all, then you'll be able to see all their measures. So you'll be able to see the measures that are completed or not completed. Now, a couple points to hit on here so that you just are aware of the information. This measure status column, what this shows is a green thumbs up or a red thumbs down. What that relates to is that the green thumbs up shows that the measure was completed. So that measure does not need to be collected for. If it has a red thumbs down, that means that the measure is still pending and that there's pending data to actually close out that measure. The care gap status for this is something to not get tripped up on. So you will see that the care gap status doesn't change as you are answering the measures here. So if you see that you have a red X, although that patient did have a favorable performance, it's not that you entered in the wrong information or anything like that. It's just that the care gap status does not update as you're entering in information. When this data is sent over to CMS for the ACO's performance, they will recognize the right compliant and performance information. So for example, I'm going to go ahead and open up this diabetes hemoglobin A1C for control measure. So what you can see here is this is checking to see if the patient had one or more HbA1c tests performed between January 1st of 2022 and December 31st of 2022. So right now this is saying no. So we know that if the patient did not have an A1C during the year, then we would go ahead and select no there. Now, let's say this patient, when you did go ahead and review their charts, review their labs, you did find that a A1C was recorded during the year. So what we would do here is go ahead and click yes here. We'd want the most recent HbA1c date. So for this measure, it is reliant on whatever that most recent test was. So even if they had a better A1C earlier in the year, but they had a later test in the year that wasn't as good as that A1C, we want to make sure that we're using that most recent date. So if they had a test that was done on December 31st, we want to use that test that was done on December 31st. So I'm going to go ahead and actually select December 31st for this date. And then we're going to enter in their most recent A1C value. So I'm going to go ahead and enter an A1C of a 7.8 and go ahead and click save here. So once you do that, you'll see that this patient now had an A1C that was updated. Now to move down to this controlling high blood pressure measure. So this is a measure that is pending here. So when I click on the thumbs down here, it will expand the measure. And what you will see here is it does ask some questions. So these questions are really defining the data that needs to be collected for the measure. So they're going to walk you through. These questions are also pulled directly from CMS itself. So these questions are predefined from them for this specific GPRO data collection. So for the controlling high blood pressure measure, it's first asking if the patient had a documented diagnosis of essential hypertension within the first 6 months of the measurement period or at any time prior to the measurement period, but doesn't end before the start of the period. So if this patient did have a diagnosis of hypertension, we would click yes here and then continue on with the measure. Now, let's say this patient did not have the diagnosis. So if you do not see that this patient had the diagnosis within their records, we'll want to go ahead and click on not confirm diagnosis here and save. So what you will see here is now that this updated to this little yellow icon. What that means is now this patient was skipped at the measure level due to not having a diagnosis of hypertension. Now I'm going to go back and just say yes here and say that the patient did have a diagnosis of hypertension. So now what it's checking to see is that the patient had their most recent blood pressure reading documented during the measurement year. So if we go ahead and click yes here, we know that the patient had a blood pressure reading during the measurement year, and then you're going to want to enter in the systolic and diastolic values. So I'm going to go ahead and enter in a blood pressure of 120/80, and then also put the date that this blood pressure was performed. So similarly to the A1C measure, this measure is also looking for the most recent one. So you want to make sure that you're using the most recent one that you have recorded within the 2022 calendar year. And then I'm going to go ahead and click save for this measure. So now what you do see here is that this measure was now updated to complete it, which is indicated by this green thumbs up on the screen. Now for also demonstration purposes, I'm going to go ahead and click on this statin therapy measure because this is going to be a complex head scratcher of a measure. So when we open up this measure, this is looking at 3 different criteria to determine if a patient was eligible for this measure. So the first criteria that it is looking at is if the patient has a diagnosis of ASCVD, active or history of at any time through the last day of the measurement period. So if this patient does have that diagnosis, then we are going to hit yes here. If not, then we would put no diagnosis. Now, what this does do now is moves us down to this next question. So this next question is actually part of the second denominator criteria for the measure. And if a patient does fall into this, they would still be eligible for this measure. So what they're checking here is, has this patient ever had a fasting or LDL-C greater than or equal to 190, or were previously diagnosed with or currently have an active diagnosis of familial or prior hypercholesterolemia. If that is the case, then we would hit yes. If they did not have that diagnosis, then we would click no here. So what happens when we click no here is now it brings us down to this third question here, where it's checking to see if the patient is between the ages of 40 to 75, and if they had a diagnosis of either type 1 or type 2 diabetes. So let's say this patient did have a diagnosis of diabetes, and they were between the ages of 40 to 75 years of age. Now, finally, what it's looking for is, was this patient taking or prescribed a statin therapy between January 1st and December 31st of the measurement year, so 2022? If so, we'll want to click yes, and then enter in the date that that medication was provided to them, or that the date that you have most recent to that medication. If the patient does have a medical reason to why they are not prescribed statin therapy, that is an applicable option here. So let's say they're allergic to the statin medications or something similar of that sort. You do have the ability to hit no denominator exception due to medical reasons. So the medical reasons would be an allergy to the medication. Likewise, if the patient just wasn't prescribed the medication and you have no record of that medication, then we can also hit no here, and that would indicate that the patient was not prescribed a medication. So what happens is when I go ahead and click no here, you'll see that the measure is now saved. Now I'm going to head back to the patient search page because I do want to also touch on one other measure, which would be the depression remission measure at 12 months, as this is probably the next complicated measure aside from the statin therapy measure. So what you can see that I'm doing here on the patient search screen is going back to the patient search screen and searching by the measure here. So I'm going to go ahead and click search for the depression remission at 12 months. And what this does is it would bring up all of your patients that were in the ranking for this measure. So it doesn't necessarily mean that all these patients are eligible for this measure, but that CMS included these measures, included these patients in this measure to be collected for your quality reporting. So I'm going to take this a step further and check under the GPRO status for pending and now search. See if there's any patients that still have pending measures who are ranked for the depression remission measure. So I'm going to go ahead and click on this first patient again by clicking on this little hand in the patient list. And this will bring us to their measure status screen. So what you can see for this patient is that they have a total of 9 pending measures. So they have 1 measure completed and then 9 pending. So this patient, for the luck of the draw, was actually ranked with all of the measures in the program. Now, if I scroll down to where it says mental health here, that's where we will find the depression remission measure. I'm going to go ahead and click on the red thumbs down to open up the measure details. And now this opens up all the questions that are related to this measure. So as you can see, this one does have a little bit more of a data mine that you need to do in order to answer if the patient was eligible for the measure or not. So kicking off this measure, what it is going to ask is if the patient had an active diagnosis of major depression during the denominator identification period. So you do want to make sure that you are paying close attention to the dates here, because these dates are actually outside of the measurement year. So the denominator identification period is looking that the patient had depression prior to the start of the measurement year, because this is checking to see if the patient went into remission during the measurement year. So again, this is looking if the patient had that active diagnosis between November 1st of 2020 and October 31st of 2021. So if this patient did have that active diagnosis, we'll go ahead and click yes here, and then move on to the next question. So now it's checking to see if this patient had one or more PHQ-9s administered during the denominator identification period. So again, that denominator identification period happened prior to the start of the measurement year, because we're looking to see if the patient went into remission during the year 2020. So this would be looking for a PHQ-9 that happened during November 1st, 2020 through October 31st of 2021. If they did, we'll want to go ahead and click yes here. Now, taking another step, what it's looking to see is if the patient had a PHQ-9 with a score greater than 9 during that denominator identification period. So with the PHQ-9 results that happened in that November 1st through October 31st time period, were the patient's results from that PHQ-9 9 or higher? So their score from the PHQ-9 being pretty high there. Let's say this patient did. So what we'll want to do is select yes here. And now what it is asking for is the date of that PHQ-9 and then the actual score of the PHQ-9. So remember, this is a date that's going to be in that November 1st, 2020 through October 31st, 2020 date range. So I'm going to go ahead and select July 21st of 2021, which does fall between the age, and then enter in that PHQ-9 score that indicated that they had a score greater than 9. So I'm just going to put 12 here. Now it's getting into the actual time during the measurement year. So this is checking to see if the patient did go into remission during those 12 months. So what this is asking is, did the patient have one or more PHQ-9s administered during the measure assessment period, which is 12 months plus or minus 60 days from the index date, event date. So what that means is that index event date is this January 21st of 2021 date that I added in here. So it's looking at 12 months plus or minus from that January 21st, 2021 date. So we're going to go ahead and click yes here that the patient did have a PHQ-9 administered. And then now it's checking to see what was that score of that PHQ-9 that was administered in that 12-month period from that index date. So it's checking to see, did the patient achieve remission within a follow-up PHQ-9 performed and scored less than 5 points on the PHQ-9 at 12 months plus or minus 60 days of the initial index event date of the PHQ-9 score greater than 9. So again, from that January 21st, 2021 date that patient had that first PHQ-9 that indicated that they had a score greater than 12, we're looking to see. So let's say that, yes, they did have a PHQ-9 that was less than 5 in those following 12 months. So let's say that PHQ-9 happened on March 16th of 2022. So that would be within that 12-month period. And then the PHQ-9 down here, we would have to enter in the score from that period. So I'm going to go ahead and enter a PHQ-9 score of 3, and then go ahead and click save. Oh, and you can see that I did make a mistake here. So that date is not the correct date here. So the follow-up date that we entered in here is not within the CMS approved timeline. The follow-up should be performed at 10 to 14 months from the index date. So this was too soon of a PHQ-9. So what we're actually looking for is a date between May 2021 of 2022 up until
September.
September 2021 of 2022. So I'll go ahead and put in a August date, as that would be within that 10 to 14 months that we're looking to see if that PHQ-9 was done. So I'm going to go ahead and click save. And now you can see that this record is successfully updated for this measure. Now I'll head back to the patient search page. And then this will just bring you back again to your patient list. Now you will be working this with the patient quality team, so they'll be stepping you through on the data points that need to get collected from your practice. As mentioned before, there is a small amount that's going to be needed to be collected within that Medicare sample and of the required patients that need to be collected. So anywhere from 10, I would say, up to 20 for a practice, and 20 would be on the very rare case that would be the number of patients that need to be collected. The measures are dependent on how those patients were ranked. So it is possible you might see a patient out of the ones that you need to be collected that only has one measure that you need to collect data on, where another patient could have 6 measures. Additionally, we do utilize your clinical and claims data related to the measure specifications that are out from CMS. So those measure specifications clearly outline different codes or different procedures or different encounters or follow-ups that we need to be looking for within your clinical and claims data. So from that, if those codes or those procedures or those follow-ups were identified, you'll see that those measures were completed for that patient. So I'll go ahead and stop here and see if there's anything else that you all would want me to touch on within the G-Pro screen right here.
Just real quick, Patrick, I don't know, it seemed like your A1C started as a skip measure and ended as a skip measure even after you put data in. It was still yellow. I wasn't sure if that's something we can expect.
No, so that would not be expected. It could just be due to the fact that I am in a test system right here. So the reason why this is a test system is that this is all de-identified patient information. So didn't want to show the real information across everyone here because that would be a HIPAA violation.
No, I think that's a good explanation. And again, the reason that there are some remaining gaps, you know, you may have explained is for whatever reason, the information, if it's in the EMR, is not coming through in a way that's codified and easily picked up. So these pending patients may have all the information, and this is where we'll need the help of the practices, is to kind of guide us there, because again, your data engine didn't find it at least where it was expected to be.
Catch much of this, did I? Where is it? Here. Oh.
If there's no other questions for Patrick, and the G-Pro formula, I know it's a lot, and that's one of the reasons we recorded this. Again, you can refer to it again. As we call you and do that, you know, we may refer to this again and help guide you onto the site so you can directly enter the information, which is one of the easier ways to get that done.
I have a question. Patrick, this is Janet. So I understand now, I had received a list from Wendy of our patients that you were looking for information for. I did not understand why you weren't able to mine some of this information. After talking to Tracy a little bit, I do understand one of the measures. However, on our EHR, which is Quantum, we have a panel on the home screen for each patient that's marked as evaluation and fall risk evaluation, depression screen, the PHQ-9, all of that is in that one packet, including the smoking status. It appears you picked up some information from that panel, but you did not pick up other things that are on that panel, because the patients that are on my list as lacking PHQ-9, fall risk assessment, depression screens are all on. I checked them and they are all done and they are available on that same panel, which you did access for smoking, but it doesn't appear it was accessed for these others. Why?
Great, so that's definitely a great question. So the reason there would most likely just be to the codes that we're actually receiving it in the data itself. So what you see on the front end, so the actual screen of your EHR, is valid in the inputs, and you're putting it into the structured format. Now, the way that your EHR may take that data and then transpose it in the way that we receive that data, it needs to be tied to a specific code that would fall into the measure specification. So if, let's say, there was just the text of the PHQ-9 being done, but then there wasn't a specific LOINC code, which is the code that would actually be within the measure specification, that's where a data gap could have happened there. So if it is in an area which is not in your case, where it is, let's say like in a free note from a patient's encounter note, or in an area that's not directly tied to a specific code, and the way that your EHR pulls that into a document that's shared to us, that could be a case where there's just the gap there. Now, the good thing though is that you do have that data available there, and that it's quickly accessible in a format, and you don't have to go through patient notes and comb through doctor notes to find that information.
So Patrick, thank you. Janet, this is Kevin O'Brien. One of the things that I have asked the PACN team, and this is a perfect example of it, is if I could be afforded the one or two of the specific examples you're looking at, I want to be able to trace that to the actual consolidated clinical data architecture file we're receiving from Quantum or the CCDA, and be able to take this from a hypothetical to a specific. And while we may not be able to resolve this issue satisfactorily in the next 2 or so weeks, as we're preparing for performance year 2023, if there's a way to make sure that as you're entering information into your screens, that it gets picked up in the CCDA and processed through the system to be fully picked up on our end, and thereby eliminating this step next year, I would like to catch it. And if there are issues on the HealthEC side, we will get that resolved immediately. So I'm highly sensitive to this. I've given my personal assurance to Dr. Pagan that I will turn over every rock I can to make sure that the doctors and nurses aren't being asked to do double work. So I just need a couple of specific examples to run.
Sure. Do you want me to send those to Tracy?
Yes, if you can make sure Tracy has them, then we have a daily meeting right now on this project with the PACIN team, and I'm trying to hit a 24 or a 1 business day turnaround on these types of issues. So
Right.
And I appreciate your focus on this, and I just want to do what's right by the PACIN docs.
Great. I have one more question. When I log into this platform, I noticed, Patrick, when you logged in, you were able to go to the drop-down window and access the practice you were looking for. When I log in, I don't get that option. It's almost as though I'm not linked to a practice. I can't see any patients unless I go to that patient search and specifically type in a patient's name, then I can find one. And I just pulled a name off the list that Wendy sent me. But when I log into the platform itself, I do not get a list of patients the way you do. Am I doing something wrong?
No, I don't believe so. I know the patients could still possibly be getting assigned to you. We are working on completing that by the end of today so that you'll be ready to run on Monday with these. So that could be the reason why. I will make note of that and take a look though, to see what you are seeing. But since you are what's called a chart chaser user role, what that means is that you only have access to your practice. So in that practice drop down that I did show, that would not be applicable to you because you would only have one practice.
Well, mine doesn't even show. When I go to that practice, I get nothing. There's no practice that, it doesn't say Peter McNeil. Yet if I search for a patient, if I go down to that search bar and put in a patient's name and date of birth, it will come up and it will say it's assigned to us. But I'm not able to see a complete list or even, it almost looks as though I'm not attached to a practice.
Okay.
Are you guys seeing the chat? Debbie McLaughlin had a similar issue, and I think she just sent a chat and copied everyone that said she didn't either. Try and click the assign button. That is where all the patient names popped up,
Yeah.
and you can see your patients.
I did that, but what comes up is every patient, patients that are assigned wherever they're assigned, and they're not sorted in any way so that ours are all together.
Gotcha.
Yep. So we'll definitely take a look at that to see what you're seeing.
And this is to the HealthEC team. You know, these are great questions that are coming up, and as people log on next week, they may be similar, or there may be other questions. What is the most, you know, obviously they'll reach out to our quality team, Janelle, Tracy, Lisa, and Wendy. But what helps you the most if they grab a screenshot?
Yeah, a screenshot would definitely be helpful. And then if needed from there, we can always make ourselves available to hop on a screen share with them as well and the team.
Okay, so yeah, a screenshot, and I guess to you know, just to be mindful, and again, I know that you were very careful of it. I know CMS is very careful of it, that when you send something as an email attachment to one of our care team, and when we send it out to HealthEC, we send it as secure there. So again, make sure that as we're doing it, if you're doing a screenshot that has PHI on it, has a patient name and other identifiable data, that we do that. But those screenshots, I know, Kevin, what you were saying, the specifics mean everything in problem solving, and you know, conveying that there's an issue is helpful. But for you to get to the root of the problem, if there is something that we need to rapidly correct in the next couple of days, actually having the specific example, I think, means a lot to you. And I just don't want to misrepresent it. And if I'm saying that wrong, please,
No,
Kevin and Patrick.
Yeah, you're saying it exactly correct, Dr. Pagan. I just want to put things into perspective for the folks that are on this call. We are in a situation where we receive approximately 130,000 files every month from PACN across about 100 different data pipelines, and close to, I think it's about 52 different data providers. That's our job. You know, I'm not saying that to, you know, to complain, but I'm not exaggerating when I say that when presenting an issue, I am dealing with trying to find something within a bucket of between 1 million and 10 million different possibilities sometimes. And so trying to navigate that quickly is a challenge. It's a challenge that it's my job. So I'll do it, but by giving specific examples, I can reduce the amount of time to a diagnosis and resolution by anywhere between a 10-to-1 to 100-to-1 factor. It is not, expressly not, a push off to say, I don't believe you're seeing a problem, you have to prove it to me. It is only that I value your time, value the fact that you are seeing something that doesn't look right, and I'm trying to do my job to be able to get it resolved as quickly as possible.
Great. I know we've reached the hour there, and if there's no further questions, we'll end this webinar. Again, this will be available. Keith, to relook at the webinar, is that also through the website?
Yeah, we're going to send out a specific communication early next week via email, directing them to where they can see the video link. But I anticipate also just including the PDF of the early slides that HealthEC showed, so that if someone's just looking for a contact information or a website, they don't have to go through the video to find it. So I anticipate sending the slide deck and the video early next week. And you'll receive it via email, and we'll probably direct you to the website.
Great. And we know this will generate some questions. And again, help us help you. We're keep the big picture in mind. We're almost at the end of this, and we're fairly close, but there are some patients in Janet's example. It looks like all the information is there, and we just need to touch base and either get you the right screen so you can log in and check all the boxes and be done with it, or help us do that on your behalf. Okay, again, seeing no other questions, thanks so much for your time this afternoon. And again, you'll hear from us shortly next week. March 10th comes real quick. So again, thanks for all you do all year long, but especially now.
See everybody.